What do your pap smear results actually mean? Imagine sitting in the doctor's office, waiting to hear what your pap smear results reveal. It can feel a little nerve-wracking, but understanding what the results mean is key to taking care of your health. A pap smear, also called a pap test, is a screening tool used to detect abnormal cells on your cervix before they turn into cancer. It helps your healthcare provider see if your cervical cells are normal, show signs of precancer, or if there might be cancer present. If your pap smear result is normal, that's good news. It means your cervical cells look healthy, with no abnormalities detected. Regular screening should continue based on your age and health history, usually every 3 years for women aged 21 to 29. For women aged 30 to 65, options include a pap test every 3 years, an HPV test every 5 years, or both tests combined every 5 years. If you are over 65 and have had consistent, normal results, you might not need screening anymore. Sometimes, results show something called atypical squamous cells of undetermined significance, or ASC-US. This is a mild abnormality where some cells look slightly unusual, but it's unclear if it's caused by an infection with high-risk HPV or other factors. Usually, your doctor will recommend further testing for high-risk HPV types to see if there's a need for closer follow-up. If the results indicate low-grade squamous intraepithelial lesion, or LSIL, it means there are mild changes often caused by HPV infection. These changes often resolve on their own, but your doctor will likely suggest monitoring or additional tests to ensure everything stays okay. More serious results, like high-grade squamous intraepithelial lesion, or HSIL, point to more significant abnormalities that have a higher chance of progressing to cervical cancer if left untreated. In such cases, your healthcare provider will recommend further procedures like colposcopy, where a special magnifying instrument is used to examine your cervix, and possibly a biopsy to get a tissue sample. If your pap smear shows atypical glandular cells, or AGC, it indicates abnormal cells from the glandular tissue of your cervix or uterus. These findings requiring additional evaluation because they can sometimes be linked to precancer or cancer. In the rare but serious case where results suggest the presence of cervical cancer cells, such as squamous cell carcinoma or adenocarcinoma, immediate further testing and treatment are necessary. Detecting these early can significantly improve treatment outcomes. Most pap smear results are reported using the Bethesda system, which helps guide your healthcare provider in deciding the next steps. Alongside the pap test, HPV testing is often used because persistent infection with high-risk HPV types is the main cause of cervical cancer. Combining both tests, called co-testing, can improve detection accuracy. Following current guidelines, women aged 21 to 29 should have a pap test every 3 years. Women aged 30 to 65 have options, including a pap every 3 years, HPV testing every 5 years, or co-testing every 5 years. Women outside these age groups usually do not need routine screening unless advised otherwise by their doctor. Understanding your pap smear results is vital because it helps catch precancerous changes early, allowing for treatment that can prevent the development of invasive cervical cancer. Remember, always discuss your specific results with your healthcare provider, who can interpret them in the context of your overall health and guide you on the best next steps. Regular screening is one of the most effective ways to protect yourself, so keep up with your appointments and follow your doctor's advice.